Hi, I'm Dr. Ben Jump, one of the dentists at Mound Builders General Dentistry in Newark, Ohio. I'd like to go over the process for getting a dental implant. When patients come to our practice, they know they're going to receive excellent care. And part of that is the process by which we go about planning and executing our dental implant treatment. The first step that we do after examining the patient's clinical situation is we take an x-ray. But not just any ordinary dental x-ray. We take a three-dimensional x-ray of the patient's jaws. This allows us to accurately plan where we want the implant to go. From that plan, I'm able to fabricate a surgical guide, which I do in our office via 3D printing. That guide is then used during the procedure so that I can place the implant exactly where it needs to go with exact precision. I'm proud to say that we're the only office in Licking County that offers this service. After the implant is placed, it is allowed to heal undisturbed, typically for a few months. After a few months then, we're able to restore the implant, whether it's for a single missing tooth or for multiple missing teeth. In this picture, you can see a patient of mine who is missing their upper lateral incisors. The lateral incisors are the teeth just to either side of the two front teeth. You can see that there are replacement teeth that were temporarily placed by this patient's orthodontist, but she was ready to have dental implants. Most dentists use this x-ray to plan dental implants. And while it provides invaluable information, it does not provide enough information to do an implant surgery. This is a three-dimensional x-ray of the same patient. As you can see, a lot more information is available to me when planning the implant case. I have a slicing window that allows me to go right to where the patient is missing her teeth. And one thing I'm able to do is look at how wide the jaw is. And in her particular case, her jaw was fairly narrow. So this tells me there are a certain width of implant that I need to place here. So what I'll do is actually place the implant in her jaw virtually, so that I can know exactly where I want these implants to go. And you can see there's not a whole lot of room there, but I am able to place an implant so that it can go exactly where it needs to be within the jaw. Let's say I placed the implant outside of the jaw in this view. If we go back to the panoramic, it still looks like the implant is placed within the jaw fine. So it really doesn't give me any information on the width. However, when I look at the cross section, it tells me exactly that I'm out of the jaw and that I actually need to be contained within the jaw. So I'm able to plan this entire case, and let's say this is exactly where I want the implant to be. From this point then, I can order or print my surgical guide so that we can have a guide that allows me to place this implant exactly where we planned it here in the software.